Alrighty, so we have this terrific gentleman who is here today, and we're going to start an otoplasty procedure very soon. We're going to do this in the office. Otoplasty can be done in the operating room, but it can also be done in the office successfully in both locations. So tell us in your own words, when did you start thinking about maybe, geez, I want to do something about my ears, and then, how'd you come to find us and decide to move forward?
Sometime around my 20s when I started to consider it. At that time it was very early phase maybe, and then I learned more about it being, I guess what I would describe as a relatively accessible procedure, fairly low risk. And then also questions of, should I do it, should I not? But over time I kind of settled on the fact that I did want to do it. I found your practice probably a year or two ago, and I was kind of watching your site, looking at it, and I noticed you were developing. That's how I ended up here.
We always tell our patients, nobody needs any of this. This is, my practice is focused around cosmetic facial plastic surgery. And the reality is people don't need these procedures, they want these procedures. You can see on this side there's a little bit of protrusion on the ear, but this side there's a little bit more. So we have to gauge this carefully and try to bring the ears a little closer to the head, and to do it as naturally appearing as possible, and to try to make it as symmetric as possible. Thanks for your attention, and we'll give you some updates going forward.